Hey everyone, it's Dr. Getter here, and today we're diving into the top 3 health concerns making waves in 2024. We're talking about the big ones: influenza, diarrhea, and RSV. Now, you might be thinking these are pretty common illnesses, right? And you'd be absolutely right. But the reason they're topping the charts this year is that they're affecting a lot of people. And it's crucial to stay informed about how to protect ourselves and our loved ones. So, whether you're a concerned citizen, a worried parent, or just someone who wants to stay ahead of the health curve, stick around because we're breaking down the causes, symptoms, and most importantly, the prevention and treatment options for each of these conditions. Let's get informed and stay healthy together, folks. All right, let's start with the one and only, the flu. Influenza, or as it's more commonly known, the flu, is a respiratory illness caused by, you guessed it, the influenza virus. This virus has been around for centuries, constantly evolving and adapting. This virus is notorious for spreading like wildfire, especially during the colder months. When people are huddled indoors, the flu finds it easier to jump from one person to another. Now, you're probably familiar with the classic flu symptoms. That sudden fever, the chills that make you want to burrow under a mountain of blankets, that aching feeling all over your body like you just ran a marathon. And let's not forget the cough that seems to have a life of its own. It can be relentless, keeping you up at night and making your days miserable. But here's the thing about the flu: it can be unpredictable. It doesn't always play by the rules. Some people might experience mild symptoms, while others, especially those with weaker immune systems like young children and older adults, can develop serious complications like pneumonia. This is why it's so important to take the flu seriously. So, how do we keep this party crasher away? What can we do to protect ourselves and our loved ones? Well, the first line of defense is getting your flu shot. It's a simple step that can make a huge difference. I know, needles aren't everyone's favorite. But trust me, a little prick is way better than a week of feeling like you got hit by a truck. Plus, it helps protect those around you. And remember, good hygiene is key. It's one of the simplest yet most effective ways to prevent the spread of the flu. Wash your hands frequently with soap and water, especially before you eat and after you've been in public places. Hand sanitizers are a good alternative when soap and water aren't available. If you're feeling under the weather, cover your coughs and sneezes with a tissue or your elbow to avoid spreading those pesky germs. Now let's talk treatment. If you do find yourself down with the flu, the best thing you can do is rest up. Your body needs time to fight off the virus. Drink plenty of fluids to stay hydrated. Water, herbal teas, and broths are great options. And consider over-the-counter medications to help manage your symptoms. They won't cure the flu, but they can make you feel a lot more comfortable. But remember, folks, if your symptoms are severe or you're worried about complications, don't hesitate to reach out to your doctor. It's always better to be safe than sorry. They're the experts and can provide the best guidance for your specific situation. They can also prescribe antiviral medications if needed. Now, for the 2024 flu season, we're seeing a particular strain circulating, and it's been quite active, especially in certain regions. Staying informed is crucial. It's essential to stay updated on the latest information from reliable sources like the CDC or your local health department. They provide the most accurate and timely updates. Remember, knowledge is power when it comes to staying healthy. The more you know, the better prepared you are. So stay informed, get vaccinated, and practice good hygiene to keep the flu at bay. Together we can make a difference and protect our communities. All right, let's move on to our next contender, diarrhea. Now, this is a topic that might make some people squirm, but it's important to address because it affects millions of people worldwide. Diarrhea is not just an inconvenience, it can be a significant health issue. Diarrhea is essentially the digestive system's way of hitting the fast-forward button, speeding up the process of expelling waste. It's characterized by loose, watery stools that occur more frequently than usual, often accompanied by an urgent need to go. Now, while it's often a minor inconvenience, diarrhea can quickly become a serious issue if it leads to dehydration, especially in young children and older adults. Dehydration can cause severe complications if not addressed promptly. So, what causes this digestive distress? Let's dive into the common triggers. Well, diarrhea can be triggered by a whole host of culprits, from bacterial and viral infections to parasites, food intolerances, and even certain medications. Sometimes it can be a reaction to stress or anxiety. The symptoms are pretty hard to miss: frequent loose stools, abdominal cramps that can range from mild to "I need to lie down" levels of discomfort. And sometimes nausea and vomiting can join the party too. In severe cases, you might also experience fever and chills. Now, prevention is key when it comes to diarrhea. It's always better to avoid the problem in the first place. One of the most effective ways to avoid those unwanted bathroom sprints is to practice good hand hygiene. This simple step can prevent a lot of infections. Wash your hands thoroughly with soap and water, especially after using the bathroom, changing diapers, and before handling food. Make it a habit to wash hands before eating as well. When it comes to food safety, make sure you're cooking your food thoroughly, especially meat and poultry. Undercooked food is a common source of harmful bacteria. Be cautious about consuming food from street vendors or places with questionable hygiene standards. It's better to be safe than sorry. And if you're traveling to areas with a higher risk of waterborne illnesses, stick to bottled water and avoid ice in your drinks. Contaminated water is a common cause of diarrhea. Now, if you do find yourself battling a bout of diarrhea, the most important thing is to stay hydrated. Drink plenty of fluids to replace what your body is losing. Those frequent trips to the bathroom can deplete your body of fluids and electrolytes, so it's crucial to replenish them. Electrolyte drinks can be particularly helpful. Oral rehydration solutions like Pedialyte, or even homemade versions with water, sugar and salt, can be lifesavers in these situations. They help restore the balance of fluids and electrolytes in your body. You can also try over-the-counter antidiarrheal medications, but it's always a good idea to check with your doctor or pharmacist first, especially if you have any underlying health conditions. They can guide you on the best course of action. In 2024, we're seeing a rise in certain types of foodborne illnesses that can cause diarrhea. This makes it even more important to be vigilant. This highlights the importance of being extra vigilant about food safety practices. Always ensure your food is cooked properly and your vegetables are washed thoroughly. Remember, when it comes to diarrhea, prevention is always better than cure. Taking simple precautions can save you a lot of discomfort. So stay hydrated, practice good hygiene, and be mindful of what you eat, especially when traveling. Your gut will thank you for it. Chapter 3. RSV, the Tiny Terror. All right, let's talk about our final contender, respiratory syncytial virus, or RSV for short. This virus, though not as widely recognized as the flu or common cold, is a significant player in the world of respiratory illnesses. Now, this one might not be as familiar as the flu or diarrhea, but it's a common respiratory virus that can cause a range of symptoms, especially in young children. It's a virus that parents should definitely be aware of. RSV is highly contagious and spreads through respiratory droplets, so those coughs and sneezes we talked about earlier, they are a primary mode of transmission for this virus. Yeah, they can spread RSV too. It's important to understand how easily this virus can move from person to person. It typically causes mild, cold-like symptoms in most healthy adults and older children. These symptoms can often be mistaken for a simple cold. But for infants, especially those born prematurely or with underlying health conditions, RSV can be much more serious, leading to bronchiolitis, pneumonia, and other respiratory complications. Now let's talk symptoms in more detail. In infants, RSV can cause a runny nose, cough, fever, and wheezing. These symptoms can escalate quickly, so it's crucial to monitor them closely. You might also notice that your little one is breathing faster than usual or having difficulty breathing. These are signs that should not be ignored. In older children and adults, RSV usually causes milder symptoms like a runny nose, sore throat, cough, and headache. It might feel like a common cold, but it's important to be aware of the potential for more severe symptoms, especially in vulnerable populations. It might feel like a common cold, but it's important to be aware of the potential for more severe symptoms, especially in vulnerable populations. Awareness and early detection can make a significant difference. Now here's the tricky part about RSV. There's no vaccine for it yet, although there are promising developments in the works. Scientists are working hard to find a solution, although there are promising developments in the works. Until then, we must rely on preventive measures, so prevention relies heavily on good hygiene practices. Just like with the flu and diarrhea, wash your hands frequently and make sure to teach your children the importance of hand hygiene. Avoid close contact with sick individuals and be mindful of your surroundings. And disinfect surfaces that are frequently touched, like toys, doorknobs, and countertops. Regular cleaning can help reduce the spread of the virus. If you have young children, try to limit their exposure to large crowds, especially during RSV season, which typically peaks in the fall and winter months. This can significantly reduce their risk of infection. Now, if your child is diagnosed with RSV, treatment usually focuses on managing the symptoms and providing supportive care. This can be a challenging time, but there are ways to help your child feel more comfortable. This might include using a humidifier to ease congestion, which can make breathing easier for your little one. Offering plenty of fluids to prevent dehydration, as staying hydrated is crucial for recovery. And using over-the-counter medications to reduce fever and discomfort. Always consult with your healthcare provider before giving any medication. In more severe cases, hospitalization might be necessary to provide oxygen therapy, respiratory support, or intravenous fluids. These measures can be life-saving. In 2024, we're seeing a surge in RSV cases, particularly in certain regions. This surge underscores the importance of vigilance and preparedness. This highlights the importance of being extra vigilant about prevention measures and seeking prompt medical attention if you suspect your child might have RSV. Early intervention can prevent complications. Remember, while RSV can be a cause for concern, especially for young children, understanding the virus, its symptoms, and prevention strategies can go a long way in protecting our loved ones and keeping those tiny terrors at bay. Stay informed, stay prepared, and stay healthy. So there you have it, folks. The top 3 health concerns of 2024: influenza, diarrhea, and RSV. These common illnesses might seem like minor inconveniences, but they can have a significant impact on our health and well-being, especially for those who are more vulnerable. The good news is that we can take proactive steps to protect ourselves and our loved ones. By understanding the causes, symptoms, and prevention strategies for these conditions, we can make informed decisions about our health and seek timely medical attention when needed. Remember, knowledge is power when it comes to staying healthy, so let's continue to prioritize our well-being, practice good hygiene, and stay informed about emerging health trends. And if you have any questions or concerns, don't hesitate to reach out to your healthcare provider for guidance and support.